We're there now.
Welcome, everybody, to another Holistic Vet Sisters. We hope you're really well, and thank you for putting up with our mishap last week. We are back with Kristi again this week, so we can answer some of your questions as well with Kristi with us too. And today we're also with Dr. Vicky Simon, who you've met before on our podcast, wonderful herbalist and acupuncturist from the UK, and Dr. Lise Hanson as well with us. So yeah, where do we want to start? Do you mind if we answer a couple of the questions? Quick fire round.
Let's do a few
Want to do
questions
that?
then.
Because
Yeah.
I did feel that Laura, you asked us a question about your Labrador, who was at the time 53 days pregnant, who will now be 60 at least. And you were asking what to do about the fact that she had Clostridia difficilis. And yeah, like what to do, because obviously she's pregnant. And I don't know whether you were wondering if the same kind of treatment would apply. I mean, you guys will have to answer that from a vet point of view, but from a diet point of view, I mean, and from a microbiome point of view, you definitely can do the same sorts of things. So you want to be getting some good Clostridia in there because there will be good Clostridia species that can be of benefit. I would speak to Carol at Biome for Pets about that. Also, Firmacutes, they're the new amazing biome that seem to be really rebalancing a lot of dogs' microbiomes at the moment. Really, the best place to find those is different types of seaweed. So, yeah, you could be thinking about maybe not the average kelp, but maybe some different types of seaweed that are in an appropriate dosage for dogs. And also, the other thing is there's some studies showing that blueberries help with Clostridia imbalances. So they would be my go-to for that. But as I said, I would actually contact Carol from Biome for Pets to find out more about a long-term plan. But in the meantime, what do we think about antibiotics for a dog 53 or now 60 days pregnant, or any other kind of support? Anyone want to take that one?
I mean, I think the major thing is like, is this an infection that's causing the dog a problem? Because obviously, if there's an infection causing the dog a problem, that could be a danger to the bitch going into labor or to the puppies. Like, is it a wound that they've swabbed that's come back from? Has it been found in feces? Like, what's the actual story of the
Just
dog?
says
Because
diagnosed, Vicky. Just says diagnosed.
so I mean, that's
So
really
my
hard to
guess
say
is it's
on.
internal. Yeah, I don't know why, but I went to internal. She's
If there's
asked.
nothing symptomatically
Mm,
wrong with the dog, I would not be treating it with antibiotics because I think in
no.
a pregnant bitch that would just not be beneficial for her or the pup's microbiome. But obviously, if there's something symptomatically wrong and the dog is very ill, that's completely different. I
Mhm.
love when Vicky visits with us because I don't know anybody else who always says exactly what I was going to say. So I can just go now because I think that's absolutely the point. If the dog has got diarrhea all over the place and is then you need to treat it. Probably at least part of the treatment needs to be antibiotics. But if the dog is well and it's an accidental or an incidental finding, then I wouldn't go that route at all.
Yeah.
I use ozone for Clostridia in puppies, and that works really well because then you don't have to use. I never use antibiotics for Clostridia, even if it's really bad, because usually ozone takes care of it. And so I don't know if you have access to ozone, but there are suppositories that owners can get online that you can use to clear Clostridia. The other thing I do a lot is fecal transplants as well, and so that would be another option. I would personally not use antibiotics just because even if it was bad, I wouldn't use antibiotics. I would use ozone or a fecal transplant.
Mm.
Tell us about ozone. I know nothing about it. I don't know if it's available in the UK.
Oh my God, Vicky, it is my new thing. It is my new rabbit hole. There is one person doing it in the UK, and they're selling kits as well to Guardians, but they also sell loads of different types of kibble. So I'm a little bit like, do I promote them?
Mm,
Don't I promote them? So
no.
anyway, go on, tell us, Kristi.
I mean, ozone is an O3 molecule, so oxygen is O2, and ozone is O3, so it has one more oxygen molecule on it. and it gravitates towards areas of inflammation. And the amazing thing about ozone is that it functions as an antibiotic, but it only kills the bad guys. It doesn't kill the good guys. The good guys like ozone, and so they stay around, and the bad guys are killed by the ozone. And so ozone can be used in a lot of different applications. It can be used as a gas or as in saline for ozonated fluids. You basically use an oxygen tank and then an ozone machine, which converts the oxygen into ozone. And then, ozone is used to clean rental cars of cigarette smoke and things. So it's been around a long time as a sterilizer. But in the medical world, it hasn't been used as much as it could because it really competes with a lot of pharmaceuticals and things like that. So, um, but ozone breaks down biofilms, which is where a lot of chronic infections hide. And so, ozone will poke holes in the biofilms and allow those chronic infections to be killed. Whereas antibiotics, for example, Clostridia is just going to live there in the biofilm and it's going to be sheltered by that mucus and not be killed. So you give the antibiotic and then it just comes back and says, "Hey, I'm back." Whereas ozone is going to poke holes in the biofilm and allow it to be killed. And so it's really a really amazing. I'm surprised you all don't have it more access to it in the UK. It is, I feel like Europe, I know Germany is ahead of the United States in the usage of ozone. So in the United States, it's been used since about the 1980s. Um, and it's widely gaining traction in the veterinary world right now. Um, and um, and it is even regular conventional vets are starting to take a look at it. It was something I don't know if you remember during COVID when Trump said that they were going to inject a disinfectant and shine a light to kill the COVID virus. Do you remember that? It got a lot of publicity because people were putting bleach on their Facebook pages and things, and they were saying and it actually was in the works of being used as a treatment for COVID because ozone could have been pretty impactful for that because of what it does. It seeks out areas of hypoxia and it kills bad stuff, bad viruses and bad bacteria while preserving the healthy cells and the healthy bacteria. And so, because of the publicity that it got on social media, it was completely discredited and completely shut down. So it didn't ever get its day to shine in COVID, but it would have been really pretty amazing for that because of the mechanism of action of what it does. But there were a lot of holistic practitioners that were using it at that time, and they were getting very good success. But
So
injecting the disinfectant is ozone. Ozone is a disinfectant. In fact, hold on just a second. I even have this is how I clean my exam room. You put water in here and then it turns it into ozone and you can clean the table and everything and it's totally non-toxic. So it's just water that's ozonated. So I use that, but that's kind of, it has so many different applications.
And
how
so
do you go on?
Sorry, Lise,
Go on.
go.
I was just going to say, what's your most common way of, how do you use it most? How do you apply it most
Well, like
commonly?
I had a whole litter of puppies come in that had Clostridia, and I treated all of them with ozone. I treated them twice. I gave them rectal ozone. I put gas into their rectum with a syringe, ozone gas. You don't want to inhale ozone gas because it can be pretty um, caustic to your tissues and not good for you. So, but if you're using it rectally, you're not inhaling it. Just put it in the syringe and shoot it into their rear ends. And then that will, kill the bad guys, strip out the biofilm. So I did that whole litter of puppies and I gave them 2 doses and it was gone and they never had any antibiotics. I use ozone before I do a fecal transplant because there's usually a biofilm present. And so I want to get rid of the biofilm so that the fecal transplant will be more received by the recipients. So it will take up shop better once you remove the biofilm. And then I have a lot of dogs that come to me with biofilms And I will treat them with rectal ozone until, and I have the owner watch for the biofilm. I say, the biofilm is this thick mucus layer that lines the colon where bacteria, viruses, yeast particles hide. And if we don't get rid of this, they will just keep coming back for more, just like whack-a-mole. You just whack them down, they keep coming back. And so I will have people use rectal ozone. Usually I'll send home a suppository and I'll say, watch for this dog to have the biofilm. And they'll notice a gelatin, like sausage coating on their feces. And usually it doesn't give them diarrhea. It usually gives them this like coat on their feces that they'll poop out over days. And then once the biofilm is gone, then I have them continue it for another week, and then we're done, and then we can work on using the probiotics to rebuild the gut.
So is this like a daily rectal treatment, or like how often are you giving that?
So it depends on, I mean, I kind of tailor it to, I actually use bioresonance. So I am a bioenergetic practitioner. So I use this machine that helps me kind of sort of muscle test on steroids the right plan. And so I will ask the machine how often. It's basically muscle testing in a computer form. And so I'll ask it how often. And so I would say, some patients I'll have them do it every other day. Some patients I'll have them do every day. Sometimes if they're really like have a lot of GI problems, if you slam them with ozone, they could get sick because it could cause die off too quickly. And so sometimes I'll say, okay, for the first week, only do it twice. And then the second week, do it 3 times. And so it just kind of depends on how sick the animal is. And sometimes I'll ease into it so that we don't have too fast of a die off.
So
So
would
the
it be for UTIs as well? What would happen? Because they're obviously linked, aren't they, with the gut biome?
Absolutely. Yeah. So if a dog has chronic UTIs, a lot of those are E. coli. A lot of those are hiding in biofilms in the bladder and in the colon. And E. coli is coming straight from the rectum into the vagina. And usually male dogs are not as prone to UTIs because of their long urethra. But for the females, if we give them rectal ozone, it can definitely impact the UTIs. You can actually give ozone directly into the bladder as well. You can infuse ozonated saline into the bladder. On male dogs, that works pretty well. I mean, you can empty the bladder and then use that same catheter and push in ozonated saline to kind of give it a nice wash. But and you can do that in females. If you have a big giant female that you think you could catheterize without traumatizing too much, you could definitely do that. Um, I have ozone that I use for, I'll use it for ear infections. I'll use it to clean the ears out. I'll inject it subcutaneously for I have a dog that has chronic renal disease that gets ozone injected subcutaneously, and that helps that dog considerably. I mean, that I have a dog right now that is 13 and she's got a creatinine of like 4.5. So she's lived with that for a year and she's been very stable, but she has a tooth infection right now. And she is fragile. She's one of those walking a tightrope. And so we have to be careful with her because she's very, very sensitive. And so I've got her using ozone in her mouth, and then we're also doing ozone subcutaneous fluids for her. And so that basically is functioning as an antibiotic for that dog because I want to treat the infection, but I recognize that this dog is very fragile and I'm concerned about wrecking her microbiome as well. So,
Yeah, which is obviously the danger. And I think for this lady, Susie, with her 12-year-old golden retriever who has repetitive UTIs,
mhm.
she's had loads of 6-week courses of antibiotics, and it's exactly what we hear, that after the antibiotic, back it comes because ultimately you haven't changed what's going on as the root
Mm.
source of the UTI. You've only changed that time. The antibiotics, of course, it's going to come back. So this dog is raw fed, including fermented bits and pieces, and has ACV as well every day, apple cider vinegar, is now on something called Sister Pro. So I'm guessing this is with a C, of course, not like Holistic Vet Sisters. And so this is obviously a veterinary
It's a really lovely supplement for
Oh,
dogs
at
with
least,
recurring.
okay. So
Yeah,
that should be doing something, but obviously this is
that would
still
certainly
happening.
be. Yeah.
But I mean, we're like, I really wish there was ozone over here for Susie and the golden.
There's
I
loads
don't know
you
if
can
there
do
is.
for those dogs without needing ozone therapy.
Go on,
Like
Vicky.
Sister Pro is the
could you do?
first line thing, and the conventional vet can prescribe Sister Pro, although often they don't, which is always frustrating. But I've suggested that to clients with recurrent UTIs before they're able to see me, and sometimes that resolves the problem before I even get to see them. It's basically like a probiotic with glycosaminoglycans, so they help the lining of the bladder, and then it also has some cranberry extract, which obviously helps to prevent bacteria from adhering. So it can, just that supplement alone can make a huge difference. So if they've only started that recently, that may resolve it. But otherwise, herbs work really well in these cases. Like, obviously, we don't have ozone in this country, so suggesting that to one of the UK clients is not going to be helpful for them. But if they can find a vet herbalist near them, then I've had amazing results with herbs and recurrent UTIs.
And homeopathy and recurring UTIs. And I think this dog has seen a homeopath, but they just obviously haven't had the right remedy. So I would try again, whoever you can get to, a herbalist or a homeopath. But whether you go to a herbalist or to a homeopath, the point, of course, is going to be that there isn't this is the remedy or this is the herbal mix for a dog with recurring UTIs. You need to find the right herbs or the right homeopathic remedies for this particular dog. So you do need to see someone, but it's definitely something that's curable. In my experience.
And then the food too, just to be honest, for a dog that has recurrent UTIs, I would probably put it on a gently cooked food rather than raw, because I think raw food is too cold for a dog with recurrent UTIs. But maybe, I mean, that would be something I would look into as well, maybe doing a gently cooked diet.
Yeah, you mean on the TCM way of looking at things? Yeah.
Well, I mean, I'm really like much more like I definitely am a species appropriate diet feeding person. I don't like to feed a lot of grains and things for my patients, but I do think that there are some pets that don't have the digestive gumption to be able to deal with the raw food. And so I prefer something that's like just basically very similar to raw, but just a little bit cooked so that it's not quite as damn provoking for those dogs without the digestive gumption. I'm imagining a Labrador that's, overweight Labrador.
But it's quite an elderly dog as well.
Yeah, 12-year-old golden retriever. I mean, I can
Oh.
remember that E. coli. I mean, the lady hasn't said E. coli, but
I think she said it actually said what it was, and it was
well, she said there was
Proteus
bacteria involved.
Yeah.
But whether that's the only one. I mean, it's one that they found.
I mean, the other thing to check in that age of dog would be like, is there underlying renal disease? Because in renal disease, often because the urine is so dilute, you're much more likely to have UTIs, and they're often, asymptomatic UTIs because, they've already got so much weeing from the renal disease. So if that hasn't been checked, which I would hope that it had been, but that would definitely be worth checking if it hadn't.
It was quite a long question. Yeah, there had been scans and there had been other investigations done, but I was going to make that comment as well, that if the scan was 6 months ago or a year ago for a dog that age, it might be worth doing it again. Just
also bladder tumors.
Yeah,
they can cause recurrent UTIs.
In a golden retriever that age, you have to consider that for sure.
The food energetics is an interesting one, especially as it's an elderly dog as well. So, I mean, I think that's a really good idea as well, switching over, to lightly cooked, which, if you want help to do that in a balanced way, you can go to the APNC website. Lots of lovely practitioners on there now that are able to make you up a recipe. Okie doke. Right. Do you want another question?
Yeah.
Right.
Go on.
Okay. So Claudia has a Chihuahua with heart issues, and her Chihuahua has a friend who has sadly had kennel cough recently, and she is wondering how long does her Chihuahua have to wait before it can play with its friend again safely without catching KC. Does that make sense?
Were they playing? I wonder if they were playing together like when the dog first got sick,
Ooh,
because
right.
a lot of times I find that maybe the dog has already even been exposed to it if they were playing at the beginning of the illness, which is when it's most likely to be transmitted to another dog. And so
Ooh.
the lingering cough, I don't think is, we don't know exactly if there's still a cough present. It's possible, I suppose, that they could be contagious, but typically they're most infectious at the beginning.
I would do what I would do if exactly the same thing I would do if it was a human with an upper respiratory infection and you really don't want to catch it, which is see them when they're no longer symptomatic. Wait till they're no longer sneezing and coughing and snotty all over the place, whatever their symptoms were. When they've recovered, when the dog has recovered, I wouldn't worry about it.
And also, if they're really worried, they can always try giving a kennel cough nosode.
Yeah, good
Because
point.
that's what I've always suggested in like multi-dog households or something like that. If one of the dogs gets kennel cough, start everybody on a kennel cough nosode, and then you should have less of a problem than if you did nothing.
Are nosodes widely available for you all?
Mhm.
More widely available than ozone, that's for
I
sure.
guess so. I think they're more widely, I don't think nosodes are very widely available here in the United States. So it's interesting to see the differences.
Even from homeopathic pharmacies.
Yeah, you can get them, but like I'm thinking, oh gosh, it would probably take me a week to get nosodes for my patient. By then the kennel cough would be long gone.
Okay.
Unless I
Oh, I
had it
just
in
have them in
stock, but
stock anyway,
yeah.
yeah.
Okay, so Judy has a wire-haired fox terrier, 4.5 years old, raw fed, only one Vacc at puppy, no chemicals in the house. She sounds like she could be on the show. She's great. Her wire-haired fox terrier, though, is female, has had no season and doesn't appear to have had silent seasons. Should she be worried? What should she do?
How old did you say it was?
4.5 years old.
Wow. That's a
I
long
mean, that's
time.
definitely not normal, is it?
No. I
That's
wonder
why
how
she's
you
asking.
determine. I wonder how you determine that there hasn't been silent seasons, though, because it's kind of the nature of them that you don't notice them. But maybe she means that there hasn't been any behavior at all that will point to hormonal changes. I would give my standard answer, which is see a homeopath. I wouldn't necessarily worry about it. It doesn't point to any, it doesn't ring any bells about dangerous. I wouldn't worry about it in that sense, but there does seem to be a sluggish hormonal system that could use a little bit of a push. For that, I would see a homeopath or an acupuncturist.
And I
So
mean, if you're really worried, and you can always see if you can get the dog scanned, like have an
yeah.
ultrasound scan and just see what the ovaries look like, see what the uterus looks like, check it's not a hermaphrodite or something, and then
But there had been one season. So
oh, there was one
No,
season.
no, I don't
yeah.
think they had.
Oh,
There'd never been any
No?
seasons. No, one Vax, one puppy
Oh,
Vax.
oh, I see.
No
Sorry, I read
seasons.
that wrong.
Yeah.
Because I was
Oh, well, now you're making me wonder. Let me double check.
because I would have thought that,
Um,
except I thought there had been one season.
oh, sorry, you're right. Has only had one season at a year old and has not had them since. You're right. So there has been one, but none in 3.5 years.
I think Chinese herbs are what I would reach for that, or acupuncture. But one thing that I notice when I was in general practice, I don't know, I think the United States probably has more spayed and neutered pets than you all do. Not many of our patients are intact. And so most vets in the United States really don't understand hormones at all because most 99% of their patients are spayed and neutered. And in my practice, so like for my whole career, I never was exposed to intact dogs. So I never really understood hormones for dogs. And now I do a lot of hormone replacement therapy in dogs and have been spayed and neutered. And one of the things, I do have a few dogs in my practice that are intact males, and they've been kind of chronically ill their whole lives, and they have a lack of erections, and so they don't get they don't have that. It doesn't happen for them. So I think of it as kind of like the similar thing, not menstruating or not having erections. And it's interesting because as I get those dogs back to health, one of the things that the owners notice in their intact dogs is that all of a sudden they're coming alive in that way. And they're saying, I never saw this before. And the dog is like 4 years old. And the one lady thought the dog had tumors. It was just the engorged
Yeah,
vulva.
that's quite common.
And,
Yeah.
and the dog was 4 and never had that before. And I was like, this is a good sign because this means this dog is getting closer to health. So I would say, I think from that perspective of not having a lot of cycles, there's some kind of inflammation going on there that needs to be worked through.
Yeah. Well, that gives Judy something to think about, doesn't it? Okay, so one other question, Mary's asking, actually similar sorts of thing. Is there any hormonal support that she can give her dog after he's been castrated? He's having to be castrated for health issues.
I think one point to ask, we need, before we even try to answer that, I think Kristi should answer it, but we need to know what health reasons, because if they had to take away testosterone for health reasons, hormonal support is not going to be a good idea.
Well, this isn't, I thought Mary had talked to us before about her dog. We might have more info than I have written down. No, it says it was a health issue. Okay, maybe Mary can let us know what that health issue is.
Yeah, I think we need to know that before we can really advise. Because if it's like a prostate problem,
exactly,
or like an anal adenoma that's responsive to testosterone, like you don't want to be giving anything that's testosterone-y, because that was the whole point.
Exactly. Yeah, it's not going to help, is it? Okay, right. Well, we're up to date with questions. I hope. If I've missed anybody's, then
you missed one important one, which was the one that we answered last week, or Kristi answered really beautifully, and then it wasn't. Then we were cut off.
The Puppy Vacc one, yeah?
Yes.
Erin's question.
Exactly.
Yeah, just Puppy Vacc protocol, I think. Although Vicky always seems to be on the ones when we do Puppy Vacc protocol, don't you?
But Kristi, you explained beautifully last week how you recommend for puppies.
Yeah.
Could you tell us again, please?
I think that what the typical protocol of a puppy right now is that they get vaccinations when they're between 6 and 8 weeks old, and then they have 3 rounds of vaccinations with distemper and parvo. And then at the 12-week mark, they start leptospirosis and they do 2 of those vaccinations. And then at the 4-month mark, at the 4-month mark, they get a leptospirosis, distemper and parvo, and rabies. And so that's the conventional perspective of what vaccinations are needed. In my own practice as a holistic practitioner, I have a long spiel I do about the risk versus benefit of the leptospirosis vaccination, and I don't recommend it for my patients. So what I do for my practice is I try to, when puppies are in training and they're going to classes, they are exposed to parvo, and parvo lives for a long time in the environment. And so if they're socializing with other puppies, potentially rescues that could have come from different states or shelters where they were overcrowded, those puppies could have parvo. So puppies that are intermingling with other puppies can be exposed to parvo, which is the concern, because if they're immunologically naive to that, they can get sick. And I did previously work in inner city Dallas, where we saw really mixed clientele, and the puppies were we saw a lot of parvo, but I never saw parvo in a case that a dog had been vaccinated twice. So I never saw a dog get parvo if they had received 2 vaccinations. And so my preference, depending on the dog's lifestyle, if they're socializing with other older dogs and they don't have, because I definitely recommend socializing puppies, but if they're in an environment where they're not getting exposed to parvo and if that could be avoided, then I'd like to wait and do one distemper parvo vaccine at 10 weeks and one distemper parvo vaccine at 14 weeks. And then I do the rabies vaccine at 6 months. And those are the only vaccinations that I give. And so it's just 2 vaccines for distemper and parvo and 1 rabies vaccine. I also don't do Bordetella, and most of my patients don't go to a boarding facility. It is required for boarding facilities, and it's not one of the vaccines that we can titer. So that's something that we have to navigate if it's necessary. But one thing that is interesting is that I've been in this field since 2002, and the first probably 3 years of my career, everybody gave a distemper parvo vaccine at 8 weeks and at 12 weeks. And then in about 2005, the pharmaceutical companies came to our office, and I remember them saying, we've found that the maternal immunity lasts longer than we thought it did previously. And so now we're recommending that every puppy gets a third one of those distemper parvo vaccines. So one at 8 weeks, one at 12 weeks, and one at 16 weeks. And, working in inner city Dallas, Texas, where we had seen so much parvo, I had never seen a problem with the protocol that we were doing. And I was swimming in parvo. So, but it is interesting because, yes, it just makes you wonder, like, there could be an argument that the maternal immunity is preventing the vaccine from taking hold, and we don't know exactly when that wears off. And so we do need that third vaccine at 16 weeks. But there also could be an argument that the vaccine at 16 weeks, adding 1 vaccine to every dog in the world, is going to be quite an increase in profit for the manufacturers of that vaccine. So, it makes you think.
But
And
I do a lot of teeter testing in my practice. I do teeter testing clinics. And one of the things that I see relatively commonly is that when dogs are coming to me at around 1 year old to have a teeter test instead of their 1 year booster vaccine, that is one of the things I see, that one of them will be negative if they finish their puppy course too early. And it's often parvo, but actually sometimes it's distemper or sometimes it's hepatitis, less commonly, but I do see both of those. And the others can all be positive. So sometimes it's only that one of them is the maternal antibodies have remained for. But that is something I see quite often, and often enough that I recommend vaccine courses that finished at 16 weeks. But I minimize it by starting later so that you can still finish at 16 weeks. And some of my clients just opt for a single vaccine at 16 weeks. And they're just very careful with what their puppy does. And we always talk about the importance of socialization and how you can do that safely and all of those kind of pros and cons. Or some people opt for the 2 because they're too worried about socialization, or their scenario means they're like in a city, or, like you described. But yeah, that is something that I actually see quite often when I'm testing.
That's interesting because I do the titers at 1 year as well. And so, I haven't made an association with that. Most of my pets are immune at 1 year, although I often will do one booster at a year and then titer them the next time, just because that's a 3-year vaccine. And then anyway, so interesting. I'm going to have to pay more attention to that.
But... See, I do a lot of 1 year because if the vaccine works as a puppy, it should last for 3 years. It's a 3-year vaccine. So the booster vaccine is to catch the puppies the original puppy vaccines didn't work for. So if the puppy vaccines worked, you shouldn't need to do that 1 booster. You should have 3 years from the puppy vaccine.
Well, I think maybe the fact that I do the second one often at 14 weeks, it might be almost as good as being at 16 weeks, because I do have a lot of 1-year-olds that do have immunity. Do you find when you titer them, like I have also titered them about 3 months after the second vaccine. And then I sometimes find crazy high titers, but that doesn't then sustain. Do you see that?
I don't do so much testing like quickly after vaccinations.
Well, I stopped doing it because I didn't find it to be super accurate. So that now I do titers like at a later point to see if that immunity is actually going to hold.
But yeah, I think, 14 weeks, some people end up saying that they're going to need to finish at 14 weeks, or their puppy's already been vaccinated at 10 weeks and they just picked it up and they don't know what to do next. And so we go for just a 14-week and then we teach test at 1 year. And a lot of those are fine. So obviously between that 12 to 16 weeks, a lot of that maternal antibody is going. And I think I read somewhere that at 12 weeks, something like only 10% of puppies still have maternal antibodies. But obviously you don't know if your puppy's in that 10% or not. And if it is, then you think it's protected, but actually it's not.
So what do you do before the puppies are, so you're doing a vaccine at 12 and 16 weeks. My only concern with that is that they're going all the way to 12 weeks without protection for parvo, and that's one of the things. So what do you do in that interim? Do you have something that you use to help them to not get parvo, but if they're waiting to 12 weeks to receive their first vaccine?
So I usually get them to use nosodes. And then just like careful management of the puppy. So if you're, take it out and about, but put it down for really brief periods of time. Be careful where you're taking it and where you're putting it down. Be careful which dogs you're socializing your puppy with, and just basically talk through all of that side of it. And I've yet to have an issue, but yeah, who knows?
Would the mum's MI not cover them for parvo between 10 and 12 weeks then?
You just don't know when the mother's maternal immunity is going to run out. So say the mother's maternal immunity ran out at 10 weeks, because I'm sure that is the case in some puppies. And I've had the odd owner that has had an 8-week vaccine and then they've done a teeth test because they want to know if they need to do another vaccine, and actually their puppy's been immune. So it's just impossible without testing to know. And I remember, do you remember when Victoria was on from France? And she was talking about how she teeters before she vaccinates to get the perfect timing. And that's because you just don't know otherwise.
So tell me, if the mother was from a line of raw-fed, minimally vaccinated, that could be on the show kind of people, would the mother be more likely to have good MI that she passes over? Or are we talking like a less healthy dog that is more likely to have had multiple vaccines and repetitive annual vaccines? Like, which type of dog is more likely to pass better MI on?
The healthier the mother is, presumably, the more antibodies she's going to pass on. But there's also a huge variety within a litter. There's the first puppy that has first run of the colostrum, and then there's maybe the runt that comes the next day, and it's, maybe it's not getting any at all, or maybe even has to have a bottle or something. So even within the same litter, there'll be variety, but it must be more likely that a healthy puppy from a healthy mum is going to not respond to a vaccine until a later age.
And that's, sometimes I see dogs that have had so many vaccinations and their titers are not good. And I think that the gut health of the dog also allows them to receive that immunity, even if they've been vaccinated. You either see both extremes. Like sometimes I'll see, titers that are over 2,000 or even higher. And then that another dog will have had similar vaccinations, a lot of vaccines, but had a really poor gut health when it was receiving the vaccines, and they don't titer well at all.
And some are non-responders, sometimes like I had one, I can't remember if it was this year or last year, and it had a negative titer with somebody else the year before, had been vaccinated, and then came to check, and it was still negative. So that dog was obviously a non-responder of some kind, and it didn't have any particular health issues otherwise. And we know that there are non-responders. And I think until teeter testing is more like widely rolled out, it's going to be hard to gather that kind of information.
Well, and we can't even measure all of the immunity on the titer testing. So there is a more immunity than we can see on paper. And so I do think it's interesting. I worked in a place where we were swimming in parvo, and we had a vaccine protocol that ended at 12 weeks, and I never saw parvo in those dogs. And I didn't titer back then. So I wonder, what their titers would look like if we had titered them, but I wasn't seeing a problem with it. So I'm guessing that they have more immunity than we're seeing on paper. So even if they're a non-responder, they still may not get the infection.
Well,
And I
this
mean,
is
that would be
really
fascinating
cool.
research, wouldn't it? To be able to, like, if you could somehow measure cell-mediated immunity without just exposing dogs to diseases and seeing if they got them.
I heard
Right.
I heard someone talk about this topic recently, and I can't remember the details of his argument, but he did say he sounded very certain that um, blood-borne immunity antibodies do describe the cellular immunity. He says that, I mean, the two are linked, and he says if you have the cellular immunity, you're also going to have the blood-borne immunity, and you're going to have antibodies. And his point was that the cellular immunity is not very effective because it's the antibodies that block infection from taking hold and causing disease. Cellular immunity, by the nature of it, doesn't even start, doesn't come into action until you are infected and you are sick and the pathogen is reaching your cells. So he was saying that, it's not an argument that cellular immunity will cover. If you don't have antibodies, you have a problem, and you probably don't even have cellular immunity. But it was, I can't remember
Interesting
his name,
because,
but
of
it was
course,
very interesting.
for many, many years, people that have been quite prolific in natural dog care, I mean, even since the 90s, have very much taught us the opposite and
I
said,
know there's a lot of
yeah,
myths out there about immunity overall, and that I think that's one of the big ones. Can I just add that it is important to mention that the WSAVA guidelines were updated last year, and they are now saying the conventional guidelines are you vaccinate at 8, 12, 16, and at 5 or 6 months. You don't give 3, you give 4. And my advice always, I say 2 things to puppy owners. I say every single puppy should have a titer test at 6 months. Then you can do away with the 4th vaccine easily just by titering them at that point. And then I don't get so hung up on whether they've had 1 or 2 or 3 or 4 puppy vaccines. I think that depends on the dog, and we quite frequently use titer testing to decide whether or not the puppy needs a vaccine, but it depends on how easily or how traumatic it is to take a blood test from that puppy. But the thing that I think makes a huge difference to a puppy's health in terms of vaccines is not necessarily whether it has 1 or 2 core vaccines, but that they do not get the leptospirosis vaccine. And I was really cheering when you said that as well, Kristi, because I think that's the problem. It's maybe not the end of the world whether that pup has a vaccine at 8 weeks and 12 weeks, or only at 10 or at 14 or whatever. But I think if you do not give the puppy lepto vaccines, you're really, really doing their health a great service.
And I mean, obviously in the UK, we don't have to give rabies. So
yes, that's
avoiding rabies for as long as possible in UK dogs is also always what I recommend.
Which is so nice for you all.
Yes.
That is really wonderful. I can see why you'd quarantine the dogs coming from our country.
okay,
Are any of the vaccines mandatory in the UK?
No, you can refuse all of them.
Yeah, no, it's not mandatory, except if you want to travel. If you cross country borders, you need rabies. But if you stay in your own country, it's all up to you.
Oh, that's so nice.
Yes.
Okay, so Kristi, you have some fun stuff you've been researching. You wanted to share with us about something called BDNF.
I just recently so I basically treat a lot of behavior issues in my practice, and I do it from a perspective of that behavior is related to or parasites, trauma, toxins, heavy metals, and that those things can affect behavior problems in animals and in humans. And I think it's just really interesting when you start really digging into it, because I have Bartonella, which I got during veterinary school. And Bartonella is a gram-negative bacteria that 30%, it's really hard to measure because Bartonella it really is very elusive and hard to get a test to be positive for it. So it's very hard to diagnose. But I actually had a little tiny scratch in my left hand and I went on to have a lymphadenopathy in my left arm. And then I was diagnosed with cat scratch fever. So I actually know that I got cat scratch fever, which many people that are exposed to Bartonella, which is cat scratch fever, they don't know that they have been exposed to it because they don't have the lymphadenopathy. It might be a silent exposure. And I think it's really interesting because, you know, for behavior and for human health, mental health of humans, infections and chronic or heavy metals and all of these chronic toxins can very much affect our brains and our mental health and our pets' behavior. And I think it's something that is really needs a lot more research and exposure because it's something that we really don't even understand or appreciate. And so, for example, you know, toxoplasmosis, the bacteria that affects cats, and it is a bacteria, and you know, the microbiome is the root of our immune system, which 80% of that is located in our guts and in our pets' guts. And this is a really interesting thing is that in wolves, when they're infected with toxoplasmosis, they actually, it affects their brain and it makes them more risk taking. And they often become the pack leader of the wolf pack. And the fact that they take more risks allows them to be more in jeopardy of getting eaten by a large cat, which allows the toxoplasmosis to complete its life cycle in the large cat because it requires a cat to complete its reservoir, it's the reservoir host. So it's just so interesting how bacteria could shape the behavior of this wolf to become more risk-taking, to become more likely to get eaten by a cat so that this toxoplasmosis can complete its life cycle.
Like
And
rabies.
That's the same in
Yeah,
I
rabies.
think they've looked at it in mice as well, and also in people, because I did a talk on the human microbiome at a festival a few years ago, and I talked about toxoplasmosis in that, because in people it does something similar, and it also affects the way people dress. So they can either be like more slobby or more like fancy dressing, depending on their toxoplasmosis status.
It doesn't turn
It's
them
really
into a
interesting.
cat then, Vicky.
No, sadly not.
that is so interesting that you gave a lecture on that because I just have been so fascinated by the by different bacteria and how they affect behavior. And you know, I feel like I'm just learning more and more about it. And when I got scratched by that cat in veterinary school, it definitely affected my own mental health for many years. And I wasn't until I figured out that I had Bartonella that I was able to address that. And I think now of so many individuals running around and dogs with separation anxiety and cognitive decline. Basically, when they have the chronic neuroinflammation and they have chronic oxidative stress caused by these chronic infections, then it impairs that. That's where the BDNF comes in, the brain derived neurotrophic factor. And it impairs that. That's a protein that's basically like a fertilizer for the neurons in the brain. And so when there's a chronic infection and it impairs that BDNF, you're not getting the fertilizer to your neurons, and so they're acting they're kind of like limping by and they're not doing so well. And so that is something that is these chronic infections are affecting BDNF, and then you have genetic predisposition to some animals, and some people naturally have lower levels of BDNF because of genetic mutations. And so that affects the situation as well, epigenetically. And then and then the serotonin interplays with that as well. So a lot of times when animals have separation anxiety, we might reach for an SSRI, which is going to increase the serotonin. And then the serotonin is going to, that interplays with the BDNF. But serotonin or the SSRIs basically just kind of bolster the BDNF, but they don't. The job of serotonin is to allow BDNF to stay around for a long time. And so when you're artificially increasing the serotonin with an SSRI, it doesn't have as effective mechanism of keeping the BDNF around. But so I just had a case of behavior problems in a rescue of my own dog, which is why I ended up on this deep dive. And she came from a high kill shelter, and she's a 1-year-old little dog. And she had been shipped across the country. She'd been pulled from the shelter, and the rescue group brought her to Colorado. And she was just fearful of everything. And she was afraid of people. She was never walked on a leash, never had her nails trimmed. And she wasn't spayed when I got her, and she was having this submissive urination. And she also was very car sick. And so the interesting thing is I had her for 6 months, and I had her for so long because I didn't spay her, and the rescue required her to be spayed before she went to a new home. But I didn't want to spay her because of her submissive incontinence. So finally, after I had her for about 4 months, the submissive urination went away. And then I got her spayed, and then I adopted her to a new home. Well, as soon as they got her to their house, she started having this submissive incontinence again, and she was urinating. Every time they would look at her, she would urinate. And she was also very carsick. And so I was trying everything to get her to stop urinating submissively, which I tried from a hormone perspective. I tried using herbals to correct it. And it's really interesting because I ended up using very low dose of ketamine on her. And ketamine is a neural reprogrammer, and it helps to rewire the brain synapses, and it increases BDNF, this brain protein that nourishes neurons and allows resiliency. And that was what resolved this little dog's problems. So she, after 2 doses, stopped being car sick, and also the submissive urination got a lot better because it was rooted in fearfulness. It was never rooted in the typical things that would cause incontinence, with the urinary system itself. It was a behavioral problem. So anyway, I just thought that was so fascinating.
So when you gave your talk, Vicky, did you talk about the Prevotella being linked to aggression and fear aggression with dogs?
It wasn't a talk on the canine microbiome. It was a talk on the human microbiome.
Oh, okay.
It was just a talk on the microbiome in general to people at a festival. And I did obviously talked a bit about animals because that's my background, but a lot of it was very human focused.
Because
it sounds fascinating. I want to hear more about.
It is what Carol is finding, though, isn't it? At Biome for Pets over here, we've had 3 years of this now, an update of the data of the microbiome in dogs in the UK. The only decent lab really in the UK is keeping this data and these profiles, and what has been explained to us year on and doesn't seem to be improving a great deal, except for the fact we've worked out that the firmicutes are involved in rebalancing, and the FMT is now available through this lab in the UK, so that's beginning to help. But this Prevotella, and in humans it's called Citarella, these bacteria have proliferated in the last 3 to 4 years and seem to be really highlighted in the biome profiles of dogs that are showing aggression, fear reactivity, this kind of thing, anxiety-based aggression, and very often linked in as well with other health issues, of course, as well. So yeah, like my students will be watching this and listening to you going, yes, this is what we see, because it is what we're seeing in the data itself.
And I also wonder whether there's a link with COVID with it, because if it's stuff that's coming out within the last 3 to 4 years, that's all the time since COVID. And we know that COVID had a big impact on dogs that were young or puppies around COVID time that weren't socialized properly, or even if owners made their best efforts, it would still have been much less socialization than the average dog would have had. and people staying at home a lot more with their pets because they were maybe working from home for extended periods. So getting out and about less, going to different places less, encountering different people less. So therefore a less diverse microbiome. And somehow, whether that whole process plus extra disinfection of things, some people were really like hot on disinfecting everything, whether all of that somehow favors the growth of Prevotella or Suterella in people.
Well, this is exactly what Carol has highlighted, and she does even go so far to say that she thinks the virus or whatever the virus was is linked in with it as well.
So
Well,
what's the
and
effect in
also,
people?
I mean,
Sorry.
energetically, so I use a bioresonance machine where you pick up different energetics of things. And I've thought it's very interesting because I have built my machine for humans and for animals because I use it for myself. And I've put a whole bunch of COVID scans in my machine. And the energetics of COVID are coming up a lot for my patients, both from the vaccine and from the actual infection. And it is interesting because recently I've had, basically in October, I had 3 patients that came in for gastrointestinal distress, and all 3 of them came up with the energetics for COVID. And then I asked the person if they recently were sick, and all 3 of them had been sick within 1 to 3 weeks of that. And all the interesting thing is that the dogs all presented with loose stools or diarrhea. And so I thought that was interesting because I don't know, it's an energetic test, it's not diagnostic. And we work on the energetics that way. But it's interesting that there was because I've done thousands of these tests, I noticed these patterns. And in October, I did have these 3 patients all come in around the same time with similar things. So who knows if there's actual energetics of the virus or the vaccine that are affecting the patient as well.
But I mean, the
Oh,
coronaviruses we know best in the veterinary world are ones that affect the GI tract because of,
Exactly.
in cats, FIP and things like that. That's often GI related. So it would kind of make sense that a coronavirus would have that inclination within animals.
but I think also frequency medicine is so emerging, isn't it? And this understanding that a virus could have a frequency to it, that then that frequency lands with another creature, whether that be the guardian, whether that be the cat in the house, the dog, whatever, and affects them in a certain way because it is a frequency that affects the body. And I think really deep down we know that frequencies do affect each other. What we feel as an emotion is a measurable frequency. The Institute of Heart Math have shown that, have published lots of papers on it. So when we feel an emotion, it is felt by someone else on a frequency level. So why shouldn't it be that our microbiome doesn't have that frequency, which is, emitted and picked up?
But that's how homeopathy works. It's like a
Exactly.
frequency medicine. It's altering the frequency. And you can have the same homeopathic remedy that would increase the energy of one patient, but calm the energy of another patient, because it's about how the frequency interacts with the individual rather than what the frequency itself is.
Yes, absolutely. So that's cool because that's my thing in behavior is that the vital life force of the dog is at play with their behavior. So if frequencies are, if we're talking frequencies of ailments or frequencies of biome being able to be transmitted or received in some way, this for me, yes, we look at this with health, but I do think absolutely it's going to be behavior is going to be related to that as well, because for me, behavior is all about the dog's vital life force flow and the health of that vital life force. So yeah, amazing.
And transmissible from the humans to the pets and the
Yeah, how they feel. I mean, we know it's on a basic level. We know how our dog picks up how we feel, but it is, for me, it's much deeper than that. The dog is picking up what's going on for us subconsciously. They're picking up what's going on for us somatically, however you want to label it. They're picking up what's in our frequency that we consciously have left behind, you know?
Mhm.
Something I always
Mhm.
find fascinating is when I prescribe a homeopathic remedy, and I don't know if this has happened to you, Lise, and then the owner goes, "Oh, that's what my homeopath just gave me."
It happened to me
Which is always
today. It
hilarious.
happens so often. Yeah, it happens so often. It's striking. But even just on how often the dog and the owner suffers from the same disease, they have the same problem.
Yeah, of course.
Yeah.
That's amazing. Okay. Well, it's been another fantastic Holistic Vet Sisters. I hope you've enjoyed it as much as we have. We've had a great convo today, haven't we? It's been lovely.
Yeah.
Thank you, Vicky, for being with us again.
No worries. I've missed you guys.
Yeah, we've
You've
missed
got
you
to come
too.
back soon. We need to get you in the diary because other vets keep taking the slots. I think
I
that's
know, but I'm
we
having
need-
baby in January, so
Yeah,
Oh,
but that's
okay,
excuses,
okay.
excuses.
Oh, come on. We had you breastfeeding a few times.
Yeah. We'll have you back with baby.
Yeah.
We'll have you back in labor. You have to come back.
Yeah, no, not in labor, please.
Okay.
Yeah, and Dr. Kristi, thank you so much for being with us again.
Thank you for having me. It was a pleasure. You all are wonderful. It's fun to collaborate across the whole world. I think that's pretty amazing.
It really is. We look forward to seeing you both again soon. Thank you very much.
See you next
Thank
week,
you.
everyone.
Is that us off? Let's just.
Oh, we're not live.
I
When
think we
did we
just. I
stop
think
being
we.
live?
This second, I seriously
Oh,
hope.
good.
Yeah.
Well, we've got it all recorded anyway.
Got me worried now after.